So in this video, we're going to look at the difficult trainee. I'm not going to tell you rules because most of the time it requires reflection and just preparation in your own mind how you will deal with a difficult trainee. Just remember, you don't have to like a trainee for them to progress. It's not about favoritism and liking. It's about dealing with trainees that you, as a trainer, have difficulty teaching for whatever trait or reason they have. So we'll start by watching a little video and then we'll go to a sort of slightly didactic lecture.
Aslam, where have you been?
Oh, I was getting a coffee.
Well, you know,
I'm not seeing Camille in a long time, and
I know, but look, this patient's been asleep for half an hour.
oh, it's fine.
No, well,
Dr. Self is fine.
I know, this is not done,
No,
you know?
I'll start.
Just sit there, please,
Yes,
and start. Do you know what we're doing?
Yeah,
Did you prep the list?
Yeah, hysterectomy, endometrial cancer, very easy, very straightforward, no issues. It'll be
Well,
fine.
just start, and but I don't want this to happen again. I don't think that's really fair.
It'll be okay.
For everyone here
It'll
in
be okay.
theatre. Aslam, can you stop, please?
Why? It's all fine.
No,
There's
no. I
nothing
think
going
this
on
is wrong.
here.
You're just not really. You're too close to the vessels there.
But the
You let
vessels
it
are
bleed.
miles away.
You have to stop.
Come on, it's fine. Let's just go a little bit more.
Aslam,
It's
listen to me.
fine.
I think this is too dangerous.
No,
you have to stop.
It's fine.
So let's just reflect on how we might deal with difficult trainees. There isn't an answer to each situation. There isn't a correct answer, but you need to reflect on how you will deal with it in your own way before you encounter it. Just remember that you have three key aims. The first is to avoid embarrassing or belittling the trainee. The second is to stop the behavior as quick as possible, because the quicker you stop it, the easier it is to stop. The longer you let it go on, the more difficult it is to stop it. And you need to keep the trainee engaged, or else they're not benefiting. So try not to embarrass or belittle the trainee. Try and stop their behavior that is wrong as quickly as possible, but try and keep them engaged. There are lots of different types of difficult trainee, and I put a list together. It's not exhaustive. You may think of a few others, but you've got the chatterbox, the introvert, the know-it-all, the slow learner, the cynic, the indifferent, the complainer, and the distracted. I'm just going to discuss some of these and put my own reflections on them, and then perhaps you can create your own reflections. I've put this list together in the course literature, and you can just think about occasions when you've seen these difficult trainees and how you might address them and how you might improve it. You might also think of a different heading as well. So the chatterbox is someone who can't stop talking, and he might talk in a slightly distracted way. He might be talking about the football when you want to talk about learning or something like that. And in a surgical environment, short commands are best because they're better understood. So I would probably say something, shall we focus on the task? Or do you mind if we concentrate on this bit? If you're in a group outside the surgical environment, you can ask them to take the chatter offline. But in the operating theatre, if you feel that the chatter is inappropriate, you need to just rehearse in your own mind how you would address that. And then you've got the opposite, the introvert, the guy or the woman who doesn't say anything. And often their contribution is important, but obviously you need to avoid cognitive overload by becoming talkative yourself to counteract their introversion. So you can use the stop command, and we could say something like, stop, now we've successfully ligated this pedicle, what are we going to try and achieve next? Try and bring them into the conversation. We then have the know-it-all. If it's safe, you could say, stop, okay, show me your way. And then you could discuss it or say, let me show you my way. But you probably need to stop and just address what you want to achieve. Often Monodal doesn't respond, and you've got to use a different type of performance enhancing instruction, because if you say, what can I show you to help you do this, they probably won't respond. But you might instead want to say something like, why do you think cutting the ureter is the best way to approach the uterine artery, or something like that. It's still a performance enhancing instruction, but don't forget the stop command. We then had the slow learner, and I'm afraid there is only one way to deal with the slow learner, and that is to give them more time. The slow learner needs more time, and the mistakes you can make with the slow learner is to let them progress before they've reached proficiency. I'm going to talk a little bit about proficiency-based progression in another module, but don't let them progress until they've reached proficiency in one stage. We've then got the cynic. That's the person who feels they'll never achieve a goal. And although regular praise is good, it can't be given as a level 2 command. So you might use it within a level 5 command. Well done with that. Now, what can I tell you to help you with the next phase? Also, in the closure, you need to address the cynicism head on. Look, you can do this. You did this part really well in the first part of the closure. We've then got the indifferent, the person who doesn't really want to be there. It's rare in surgery. Sometimes you've got a trainee in another discipline who doesn't want to be there. We regularly have urologists and colorectal surgeons in our theatre. In fact, they really enjoy being in our theatre, but I could envisage a time when they might not. Just say stop or pause in surgery and ask them what their thoughts are. Sometimes the trainee is not actually having to do something because you're having to take over and they're indifferent while you're operating. So if that were to happen, you do need to engage them in conversation, but stop operating at different points if it's safe. We've then got the complainer, and in surgery it's often someone who feels they're not getting the same opportunities or not progressing. I think it's important, and we've got this module on proficiency-based progression in after this one, that you explain, and you should be using the closure and the verbal set to address the complainer, to understand why you're not moving forward with them, if that's what the problem is. And then we have the distracted. The distracted can vary between the surgeon who has problems at home or who's being distracted by other things going on the ward. Please just take the phone off them. The physical set is the best place to concentrate on this. Get the phones out of the operating theatre. Try and prevent people from interrupting an operation with other things going on. Some people use the HALT command. HALT stands for hungry, angry, late, or tired. And this is best done in the team brief. Is anyone hungry, angry, late, or tired? Yeah, I've got tickets for the opera tonight. I'm very keen to get out on time. I've been up all night with my baby. We just understand what's going on. If someone's hungry, you can give them a bite to eat. If someone's angry, you can discuss it. That's an important thing that some people do if it's a problem in your theatre. So in summary, there isn't a correct answer for every different type of trainee. I haven't given you examples of all the different types of difficult trainee, and I'm sure you can think of some others. But what you need to do is you need to write down in your own spare time the types of difficult trainee that you can think of, and try and think about and reflect how you will deal with them. Thank you very much.